Good morning, everyone, or good afternoon for those of you ahead of us in time zones. And welcome to today's webinar on engaging with communities. This webinar is brought to you by the Medical Research Council Clinical Trials Unit at UCL, based in London, and the Global Health Network at the University of Oxford. I can see that people are still joining the call, so we'll give it another minute or so before we kick off. But thank you for joining. I hope that you're going to enjoy this session. We're going to hear from 4 experts on the topic and hopefully have some lively discussion. So I'm looking forward to it. So just whilst people are joining, before we begin, we'll run through some housekeeping. So firstly, this session is being recorded, and the recording will be shared in the next couple of weeks on the Global Health Network platform on the MRC Clinical Trials Unit at UCL Hub. So you can review and share the materials. Louis is going to share a link for that in the chat. So please do look out for that. Please do use the chat feature for introducing yourself, or if you have any technical issues, then we've got a team on hand to help you with that. And the Global Health Network team are used to these things, so they can be really helpful.
Oh, I think Annabelle's just dropped off there, so hopefully she'll rejoin in a minute or two. But it was just also to say you can use the Q&A function to post your questions and comments, and you can do this anonymously. The panel members may be able to answer some of those questions as we go along, and then some of those questions will also be pulled out, and we will have a discussion after we've heard from all the panel members. Oh, I'll hand back. I think Annabelle's back. I'll hand back to you, Annabelle.
Thank you. Sorry about that, everyone. So yeah, as Kate showed, it's great to see participants from all over the world joining us this morning. So I should introduce myself. I am Annabelle South, and I'm a Principal Research Fellow in Communications and Impact at the MRC Clinical Trials Unit at UCL. And I'm delighted to be joined today by Lungile Jafta, Youth Participation and Engagement Expert with the Penta Foundation, who work in child health research, and Lungi is based in South Africa. Noni Mumba, who is head of the engagement platform at KEMRI Wellcome Trust Research Programme in Kenya. And Kate Sturgeon, who's patient and public involvement coordinator here with me at the MRC Clinical Trials Unit at UCL. And Vincent Basajja, who is community liaison officer with the MRC Uganda Virus Research Institute and London School of Hygiene and Tropical Medicine Uganda Research Unit based in Uganda. Our agenda for today, we're going to hear a short talk from each of our panelists, and then we're going to go to panel discussion and Q&A. So I am going to ask Lungi to speak. Lungi is Youth Participation and Engagement Expert with Penta. She's got years of experience in engaging and empowering young people to actively participate in clinical trials that directly affect their lives. And she's currently responsible for youth trial boards in the Sub-Saharan Africa region. And she's going to tell us more about the youth trial boards and how they can help engage young people living with HIV in research. So over to you, Lungi.
Good morning, everyone. Thank you so much for this opportunity. My name is Lungile Jafta. I am based in Durban, South Africa, and I am currently working as a PPI consultant with Penta. Mainly, I do coordination and project management for the Youth Trials Board, which is based in Sub-Saharan Africa. We currently have boards in South Africa, Zimbabwe, Uganda, and recently in Kenya. Today, I'd like to share with you the experiences that I've gained over the years working with the various communities, especially with the youth. So working with various communities over the years, I've gained a bit of experience, and it has taught me to always know and learn and research the community that I'm going to work with. Each community is very different. Their norms, their culture, their laws, their education system, and so forth is very different. So if you're going to engage a community, it's important for you to do your due diligence and have some background research so that you know the type of community that you're going to be working with. For you to have access to the community, you must always acknowledge the stakeholders. Those are the gateway to the communities, and those are the people that may actually lead you to the right group of people you want to engage with, depending on the type of project that you're running, because they live in the community, they know the community members very well, and they know they may even know what works best in the communities. Always be open and inclusive. Different communities have different languages. They deal differently with various races and genders and so forth. And you must always have that in mind, because the language barrier can be so big in certain instances that the message that you're trying to carry to the community is not carried through. Simple things like breaking down your language. Even if you're using English, don't use language that is too difficult or too scientific. Try and break down the different concepts, so when you're speaking to a layperson, they understand what you're talking about. Always be wary of communities such as the LGBTQI community, because in some places you're not even allowed to even mention them. So doing your research prior, you will be able to know what to say and what not to say in various communities. When you're engaging young people, always do so at their level. If I am presenting something to young people, whether it's a new idea or we're having a roundtable discussion, it's always important to make your structure very friendly, very youth friendly, something that is not too formal, and the language that you use even there. You must know what the young people use these days. If it means you ask them to teach you or them to break down what type of language they use, then it is good, because that way you will know what they mean when they say something to you. It could be even slang, and that slang word could be conceptualized to explain something in a positive or negative way, so you don't have to keep asking them, so when you say yeah, or that's hot, or that's right, whatever they use these days, then you won't have to keep going back and saying, oh, so that means good or that means bad. So it's always important to also learn the young people's language so that you engage them better at their level. Empowerment is always key. When we go into communities, we are always bringing our projects and imposing what we want to do to them. But it is also important to teach them something whilst you're there. That is an opportunity for you to take away myths and beliefs that are incorrect. So use that opportunity. It could be something very small and may not seem significant to you, but you clarifying gray areas about certain topics will also help the community to have the correct knowledge about those topics. And it is always important to sustain relations. A good rapport always is helpful. You can always go back to people who you sustained a good relationship and build further relations. It could be 10 years, 5 years down the line, but if the relation was built, if it was solid and it was good, they will always welcome you back into the community. They will always be willing to assist you on your next project. As with everything, nothing ever runs smoothly. If it's running smoothly, you must ask yourself what you're doing wrong. There's always challenges, and you must always be able to work around and overcome those challenges. I've mentioned this one before in the previous slide. Language and culture is always a barrier. You could go into a community who have a lot to share with you, their experiences, their lived experiences, and the information that they carry could be so much. But because they are not able to relate to you in English or in a language that they are comfortable with, you will lose out a lot. So that's why I always say, do your research. So if you know that the community you're going into, they're not comfortable in speaking this particular language, get someone who will be an interpreter so that you do not lose the information that you're going after, so that they're able to express themselves in their local language, and the interpreter can therefore interpret it for you. Infrastructure and stuff are always a big challenge. Communities don't have the type of infrastructure that we need, and we always struggle, especially if we're meeting on a Saturday. You'll find that there's only one community hall, or the school's not available to meet on Saturday, or the clinic is closed on a Saturday. So those type of challenges always limit the times or the availability of the young people, because you may have the young people available on Saturday, but you don't have a room or a meeting room to meet with them. The staff are not available on a Saturday, or the staff are available on a Friday, but the young people are at school on a Friday. So these challenges, you need to work around them, even at your proposal writing stage, so that you know that this project will run best when it's done on a Saturday, so that even when you're approaching staff, they understand that this project will be run on a Saturday, because that means we've got better access to young people. Funding is always a problem. The best thing to do, and this goes to all the proposal writers and scientists that are in here, when you're writing up those proposals, please include enough funding for PPI activities, because the allocation of those funds at the end, which is usually very minimal, doesn't suffice for the amount of work that we want to do in the communities. So it's always important that you allocate enough funding for these projects. When you go into community, always address the expectations of the community and the reality of the project. Each community is going through so much right now. They've got so many problems that they want to be addressed. So if you come to them as a hero who's about to address problems that you don't know anything about, will create expectations, and there may be a fallout at the end. So when you're presenting a project to a community, be very clear about what you're there to do and what you are able to do and not able to do, so that you don't cross boundaries and then end up creating animosity between you and the communities. Some gatekeepers can be enemies of progress, and you must tread this one very carefully, because those people can make or break your project. Some people believe that if you're coming to a community, you're coming to take away people from the community, you're coming to influence them negatively, you're coming to take away jobs, whilst you're not. So it's very important for you to sit down with all those gatekeepers and address these issues, so that they know that you are there for the community, you are there to work with the community, you're not taking anything away from the community, but rather you are enriching the community, and it's not about them, but the entire community at large. Geographical location is always an important barrier as well, because there are some communities that we wish or we want to engage with and work with, but because they are in the outskirts or in areas which we cannot easily access, and we don't have funding to go and stay there for a week and engage the communities, because funding is limited, etc. That also limits the project scope, because it means that you can only work in areas where you can access the communities easily. Most importantly, evaluation. It is important for us to evaluate our work, so we know that the impact it has done in the communities. And we do this very minimally, because at the end of the project, there's always very little funds left to do the evaluation. Like I said in the beginning, I work with YTB across sub-Saharan Africa. These are some of the materials that the young people have produced. When we work with young people, you must always be open-minded. You might think you want to do a poster, and they tell you, no, a leaflet will work better. These are some of what they've done in the past, and they've actually evolved from doing leaflets to posters and now doing videos, because they feel that TikTok is what's hip and happening, and that's how you communicate with the young people better. So that's why it's always important to go to the young people with an open mind. And last but not least, some top tips. Always build trust with the community. Communicate clearly what your project is about. Involve the local community. Make them feel that they are part of this project. Provide education. Whatever opportunity you have, no matter how small it is, educate the community about the topic at hand. Appreciation is always key, whether you reimburse them in terms of a certificate, payment, or something that they can take home and say, I was part of this project and this is what I got from it. The community always appreciates that. Be flexible with date, time, and place and ideas, because you have to work according to where and how the community is available. And last but not least, it is not about you. If you're doing a project in the community, go there with a blank canvas and let them paint the picture for you. Thank you very much.
Thanks, Lungile. There were some really really helpful practical tips there from you. And I know I've got some questions to follow up with during the panel discussion. So we're going to hand over now to Noni Mumba. Noni has been heading the engagement platform at the KEMRI Wellcome Trust Research Programme in Kenya for the last 10 years. The platform has 3 engagement areas: community engagement, public schools and university engagement, and policy engagement. And it aims to strengthen relations, building mutual understanding between researchers and communities and stakeholders in the research sites where the KEMRI Wellcome Trust Research Programme works. So I'm going to hand over now to Noni, who's going to share some of her experience of engaging with communities in Kenya.
Thank you very much, Annabelle, and hi, everyone. It's a real pleasure to be part of this panel of experts sharing our experiences and top tips on community engagement for global health research and also clinical trials. So I work in Kenya in a large research institute. We are about 800 staff. We carry out a range of research studies covering several health areas. We have a health and demographic surveillance system area where we collect health and demographic data from a population of close to 300,000 individuals along the coastal part of Kenya, around the catchment area of a large county referral hospital. So in Kenya, we have a county system. We have a devolved government system where we have 47 counties, and Kilifi is one of those counties. So our research program is based in Kilifi at the coastal part of Kenya. Kilifi is predominantly a rural area with about 3 or 4 urban localities, but mostly just rural. And then we also have a research office in Nairobi, which is our capital city. So I think where I'll start from is basically the whole aim and intention of why somebody would do community engagement for research, especially research that involves humans. People are going to participate in that. We, in our own experience, we like to think about the rationale for doing community engagement as very, very importantly being intrinsic in nature. So the key priority for us generally is developing relationships with the population, the communities, the publics, the stakeholders, around the areas where you're carrying out your research work and you are going to be recruiting research participants from. And I think one of the things that we have learned basically is that when you have the relationships right, then you're providing both stakeholders and community members who you will be requesting to participate in studies or give feedback in studies. When you build the relationships, you're giving them an opportunity to feel appreciated, to understand that they are important, that their opinions, their views are important. You're giving them an opportunity to understand the research. So where we work in Kilifi, as I've said, the area is mostly rural. So we have quite a large percentage of low literacy levels among the population. Literacy has been increasing over the years, but we still have, quite a number of the population that has low literacy levels. And so you want to have them understand what research is, be able to understand the different concepts, procedures, and processes of research. But more importantly, while building the relationships, you also want the researchers, the scientists who are carrying out research work to be able to also understand issues from the perspective of the population, from the perspective of the community. So we like to think about, community engagement as a way of creating and developing trust, as has already been said by my colleague in the previous presentation. Trust is very important. And so as you're developing these relationships, you're building the trust, but you also have an understanding that the trust can be broken, and therefore important to understand what has broken the trust. If you have developed a relationship and it has gotten to a point where that relationship has broken or has been is facing challenges, then it's important to understand where is that coming from, what's the genesis, what is the root cause, and then work backwards to be able to remedy. So that is one area of engagement, intrinsic building relationships, very, very important. And there are many different things that you can do to build relationships. In our own experience, we have gone out, into homes, into the villages. We have worked with community leaders. We have held meetings to be able to speak with community members, talk to them about research, and then listen to them in terms of what they think is important and what they think we need to be doing in as far as research and research procedures are concerned. Helps also to build understanding and remove any types of misconceptions that communities might have about research. But then community engagement also has instrumental value. So while you're building the relationship, then you are enabled through that process to be able to learn very important things that then would support your research, would help you as a scientist make your there's a term we like to use, people-centered research. When you understand the population, you understand where they're coming from, you understand, socially, their social networks, you understand, what perhaps leads to them getting diseases and so on and so forth. You understand some of their fears, you understand some of their, you get to hear their own knowledge that they have, because the community members also have their own knowledge, what they're doing in terms of disease, how their social networks work. That is important information for you as a scientist to be able to understand. And incorporate into your research design, into your research planning, into your research implementation. Through engagement, we've been able to learn very important things that then sometimes have impacted on studies. We have approached community members to help them, rather to help us. We have approached community members to help us understand how best, for example, can we compensate community members who participate in studies? What kind of things would they want to be reimbursed? We have ethics guidelines. Ethics guidelines are very broad and they need to be contextualized. And when you build relationships with community members, then they can help you work out the contextual aspects of ethics guidelines. When we are told you need to compensate maybe as per local basic wage. What is that local basic wage? You may read it in maybe government documents or something like that, but community members will help you understand. And we have worked on that to be able to develop research policies within our research program based on conversations that we have had with community members. I think the other thing that is really important to think about when it comes to community engagement is within global health research, community engagement is initiated by the researchers. It's very rare that you'll find community members themselves being the ones to approach scientists and tell them, come and engage us. So often, the initiators of community engagement are the scientists or research institutions, research centers, research projects, if you're talking about one principal investigator and the projects that they want to undertake in a particular area. And so it's really important as a scientist and your research study team to be able to cede that power and for community members to feel drawn in, feel that they're part and parcel, and that their views and thoughts are important in that entire process. Otherwise, then you risk it being, sort of like a tick box. So you have to put mechanisms for receiving feedback. In our case, for example, when we were developing our community engagement strategy, we involved the community, we involved stakeholders like the Department of Health, we involved scientists. And so we co-developed our engagement strategy. And then we put in place mechanisms for receiving feedback from our community members. For example, we developed a helpline, a telephone number that community members could call to share their views. And then we encourage them when they come for meetings, they bring, sort of like the views and questions that are coming from other community members. So really, really important to be cognizant of the fact that as the initiator of community engagement activities, you must be willing to be able to cede power and actually bring on board our community members in a meaningful way. I'll stop there. I think that's just about my 10 minutes and hand it over back to Annabelle.
Thanks, Noni. That's great. That's there's some interesting things there that I want to probe into when we have some time for discussion. But really interesting. Thank you. We're going to hear now from Kate Sturgeon, who is the Patient and Public Involvement Coordinator at the MRC Clinical Trials Unit at UCL. So she supports the studies that we run at the unit with their patient and public involvement activities. And as well as that, she has another hat. She also works as capacity strengthening coordinator. So those of you who visited the MRC CTU at UCL hub on the Global Health Network will have seen the results of some of Kate's work as well. So it's great to have her as a panelist today. Over to you now, Kate.
Thank you, Annabelle. I hope you can see my slides okay. So as Annabelle said, I'm the Patient and Public Involvement, or PPI, coordinator at the MRC CTU at UCL. So I think, first of all, it's just important to distinguish what we mean when we say patient and public involvement, because in the UK, when we talk about involvement, we're talking about the active inclusion of patients, their families and carers, or the public as research partners or representatives throughout the research process. And I'll refer to those people as PPI contributors. So involvement is what my colleagues are referring to as community engagement. But when we talk about engagement in the UK, we're talking about where information and knowledge about research is provided and disseminated. But the researchers aren't interested in what the public views are there. They're just telling people about their research. So it's just to clarify that at the beginning. So in my experience, PPI can make a huge difference to trials and studies, and we should be involving our PPI contributors throughout the research process. I just want to give a few examples of what we've been doing at the MRC CTU. So PPI can influence the trial design. So the Octopus trial is a trial that tests multiple treatments at different times, and the aim of slowing down the progression of multiple sclerosis in participants with progressive MS. And the Octopus trial was co-designed by people affected by multiple sclerosis, and they raised really important considerations at the start about the trial design to do with like fairness and access to the trial, which resulted in sites all over the UK and an inclusive as possible eligibility criteria, which just would not have happened had they not been involved from the start. Our PPI contributors co-design and develop patient-facing materials. So for example, our patient information sheet template at the unit was co-developed with our PPI contributors. They've co-designed logos for studies, infographics for recruitment or disseminating results, or just other tools for communicating a message. We also have a model of PPI contributors as members of committees. So for example, on clinical trials units, such as the MRC CTU, we have PPI contributors on the protocol review committee, and they review all the protocols that come through for new studies and trials. And they also sit on our PPI group to decide what PPI activities we should be doing throughout the year in the unit. We also have members sitting on individual trials, so they will be on oversight committees, such as a trial steering committee or a trial management group, or PPI contributors can just be involved in a one-off involvement, such as a focus group or a workshop that might be to think about, give some insight into a research question, or how to convey a message better, or how to brainstorm how to overcome, say, recruitment and retention issues if a trial's having problems. And all of these can have a huge impact on the trial design, recruitment, retention, and the messaging of results. These are just some of the outputs from PPI from the unit. So the CAPIT trial logo, CAPIT was a trial looking at pneumonia in children under the age of 10, and our PPI contributors co-designed that logo for the trial. The ALFI study, which was the adults and adolescents living with perinatal HIV, that leaflet was developed by young people to try and think about how the study findings could be communicated in a way that would be accessible and appealing to young people. And then we developed the GDPR animation, which was also co-developed with young people because we wanted to have a tool to help explain GDPR, knowing that young people are not going to be reading really long patient information sheets and all the legal jargon. But obviously, it's really important they understand what they're consenting to, so it is informed consent. So just some of the challenges, and I think some of my colleagues have already touched on these. So it's interesting, we all find similar challenges. So yes, having enough funding to do meaningful PPI is always a challenge. And I think often trials and study teams don't think about what PPI they want to do at the start. And then halfway through, they want to do a focus group or a workshop, and they just haven't got the funding to do that PPI activity or indeed pay their PPI contributors properly. Doing PPI where there isn't an established group. So for example, where we've done trials in acute infections, where there isn't an established support group or organisation like in our cancer trials can be difficult. And then representation from underserved communities is always difficult. We're starting at the MRC CTU to think about how we can do PPI in the TB research field, where there's historically been very little representation because that community has been quite hard to reach. And then PPI and methodology research is tricky. It's a very niche area. Again, we started to think about this and we did a pilot where we set up a methodology PPI panel for a couple of years. So some PPI contributors could support our methodologists on a few projects. And we all agreed that PPI and methodology is very different from PPI in clinical research. It's complex and it's more the complex and more abstract nature of methodology can make it more difficult for researchers to communicate their research in plain English. And PPI contributors normally have much less relevant background, knowledge, and experience than when contributing to a clinical trial. Evaluation, as some of my colleagues have also talked about, that can be hard to show that the PPI had the actual impact on, say, recruitment. So it's thinking about what tools we can use to really show the impact and measure what we've done. So some of my top tips, and I think, again, there are some similarities here. Leadership is so important. And for me, when I'm working across lots of different trials and studies, it's really important that researchers have a visible designated person that they can go to for PPI advice. And you really get out what you put in. So if you can invest properly in your PPI, you get much more from your PPI and you avoid tokenism. Budget enough for PPI or community engagement. That means really thinking about the PPI you plan to do at the start of the trial, so you have enough funding for all your PPI activities, but also to be able to appreciate, recognise your PPI contributors. And I think, as some other people have also said, so important to develop genuine and effective partnerships. So building those good relationships with your PPI contributors, your stakeholders, charities and organisations you're going to work with really will help you in the future as well, when you may want to go back to them and ask for some advice or for some PPI again. And then try and evaluate the PPI to show it has impact. It really helps us see and learn what has worked well or what has had an impact, and also then clearly how to improve what we're doing and what might go better in the future. Thank you very much.
Thanks, Kate. That's really helpful and good to hear some specific examples of where community engagement or patient and public involvement has made a difference to studies. We're going to hear now from our final panellist, who is Vincent Basajja. Vincent is Community Liaison Officer at the MRC UVRI and LSHTM Uganda Research Unit, and he has over 25 years' experience working with communities to support biomedical research and other health interventions, including clinical trials. And he has a keen interest in creating sustainable and mutually beneficial partnerships between researchers and stakeholders, like we've been hearing for the importance of this from our other speakers. So I'm going to hand over now to Vincent.
Thank you so much for the kind introduction. My name is Vincent Basajja, and as introduced, I am Community Liaison Officer working with Medical Research Council, Uganda Research Institute, and the London School of Hygiene and Tropical Medicine. I am based at the Masaka Field Station. Masaka is about 135 kilometers from the central capital city, Kampala, southwest of Uganda. And we work with quite a number of districts. We conduct a number of research projects ranging from interventions, non-communicable diseases, and then clinical trials testing new products. So why community engagement? And that's the first question we wanted to answer when the unit invested a lot in community engagement, because we are committed to and we believe in the unique power of partnerships. And for this reason, that's why we have developed a robust community engagement approach to conduct research with high integrity and designed to answer community questions. We also want to make sure that we build and sustain collaborative, transparent, meaningful, and mutually beneficial relationships with a wide range of stakeholders, not only study communities, but stakeholders beyond study communities, including Ministry of Health, the regulatory bodies, international community, to make sure that the research we conduct is relevant to all the stakeholders. We also want to promote research literacy, because we know that when we have a research literate community, then they can co-own research processes, and then they are also empowered to contribute meaningfully to the research processes. In our processes, in our community engagement and development processes, we are guided by both local and international guidelines, and I've shared a pictorial presentation of these guidelines. So our pathway is that we, first and foremost, wish to understand the communities that we work with, and that's why we conduct formative research, which enables us to gain informed understanding of the local populations. It lays foundation for trust building, and then it also informs our modes of engagement. And then from that, we collectively with the communities involved, develop a community engagement plan, and we also have sub-plans, as I have indicated on the right side of my slide. And all this is meant to make sure that we build a good foundation for informed consent, so that communities do support research from an informed point of view. So we've also recognized the importance of stakeholder advisory mechanisms. The major form of our advisory mechanisms, the Community Advisory Board, and this is we have members drawn from a wide range of stakeholders. They are trained to provide independent, constructive advice. They also act as a link between researchers and communities. But we also have other informal advisory structures, peer leadership, the village health teams, and then other research institutions that work within the communities that we happen to operate. So one important thing that we acknowledge as we engage communities, and one big lesson that we've learned, is that as we engage communities and involve them in research, they are also helping us to learn certain things. For example, they're helping us to appreciate their cultural values and norms, as we also try to make them understand the importance of supporting biomedical research. So that continuum that I present to you shows that researchers and communities need each other to build competences. So communities help us to build social cultural competences, while we also help them to build research competences, so that we strike a balance and work as equal partners. So our experiences have been that successful community engagement should be structured, systematic, and sustained throughout the time you are engaging with the communities. It's not like a drop in and then out, and then you come back to the communities and tell them you have a new project. So it should be sustained, structured, and very systematic. It is a multifaceted process that requires adaptability and flexibility. And my colleagues have alluded to this fact that once you go in, you need to understand how you tailor your community engagement and involvement to the needs of the people so that you can effectively partner up with them. We've also learned a very big lesson. One of our experiences is that integrating social science in our community engagement processes has facilitated deep understanding and timely collection and response to community concerns. Sometimes when you conduct research, you think you are taking it to them, when actually you also need to learn from them. So our integration of social science has enabled our research processes to get timely feedback from the communities, and then we respond so that we avoid unnecessary conflict that might arise from misunderstandings because you are conducting research, yet you are not listening to the inner feelings of the people. And the social science aspect of our community engagement helps us to understand these and then respond to them in a timely manner. So there is also one thing that we've learned, that basic scientists need to appreciate the value addition of community engagement and involvement to the research processes. Sometimes you think they do, but when you tell them this is what we have to do to make sure that communities support our project, you see some level of hesitancy, but this is changing because as a unit, we've embraced community engagement and we've also learned lessons from other organizations. So our community engagement processes are meant to identify, inform, involve, engage, and consult. And then we know that when we empower communities, then we've established partnerships that are based on equality between the researchers and then the communities. So we've learned that working with the local and international advocacy experts such as EVAC and leveraging on their networks and platforms is very, very important. And this has been very evident when we conducted the PrEPAC trial. We worked with EVAC and they really helped us a lot to shape our community engagement tools and approaches. As earlier mentioned by my colleagues, monitoring and evaluation should be a crucial component of community engagement. One, we need to assess our community engagement approaches and strategies. We need to justify the resources allocated to community engagement activities. We also need to evaluate community value addition to research processes, and this will now help us to inform future community engagement mechanisms, strategies, channels, and tools and practices. Some of the challenges that we've encountered as we engage communities is, one, the world is rapidly changing. The nature of research conducted is changing. The trial designs are changing. So keeping pace with ever-changing scientific world is a big challenge, but we try as much as possible to make sure that we work with our colleagues in the research world to be on top of our game. The other challenge is also addressing myths and misconceptions. This could be because of skepticism, vaccine hesitancy, the power imbalances, vulnerability, and other factors. So that remains a challenge, but we've tried to make sure that we strategize as much as possible to ensure that there is equity as we engage and work with the communities. I don't need to dwell on this. Minimum funding for community engagement has been highlighted by almost everyone. We also have situations where we are dealing with high-level mobilities among some communities, so that engaging them sustainably becomes very difficult because the people you see now, when you go back to engage them, are not where you expect them. But we've devised means of contacting them through mobile phones, also developing a peer education mechanism so that the peer leaders can reach out to them and provide information to them. And then converting decision makers to support and integrate community engagement in the research processes has been a challenge. But as I said, we seem to be overcoming this by having constant engagements and discussions with the policymakers. We also have a challenge of responding to community needs. We do as much as possible to make sure that our communities are left better than we found them when we start working with them on any single project. But the needs are so enormous, and that's why we treasure the beauty of creating partnerships with other institutions so that what we can't provide can be provided by our partners in the health sector, the development sector, and other sectors. So we do our corporate responsibilities, but we also know that we don't have enough resources to cover all the community needs. And we also do as much as possible to make sure that we don't raise unrealistic community expectations. We are as truthful as we possibly can as and when we engage communities and involve them in our research processes. So in conclusion, we notice that there is need to enhance community engagement, promote research literacy among a wide range of stakeholders. And competence building is a prerequisite for both scientists and stakeholders to bring science and communities together for a common goal and purpose. And we've also realized that community engagement facilitates researcher community mutual trust building, and it lays the foundation for successful research conduct and research outcome acceptability. One other important aspect, and that's going to be my last point, is that sometimes researchers do conduct research and never provide accountability to the host communities. We found out that the dissemination of research findings, acknowledgement of community participation is the best way to account the communities, and it's a very, very important aspect of our community engagement and involvement processes. So that's a pictorial presentation of the different community engagement activities. You can see on the extreme left up, we have a community advisory board discussing and inputting into our research processes. In the middle, I was engaging a community about the PrEFAC trial and then seeking their input on the best practices that would deliver this project. Down, we engage youth in the sports. We also do corporate responsibility by helping health institutions improve their conditions. During COVID, on the extreme right, during COVID, we also donated items to help communities cope with the distress that had been caused by COVID. So I want to acknowledge our study participants, our host communities, our community advisory boards, our local and international research partners, and then my fellow staff at the Medical Research Council. Thank you very much, and I look forward to questions. Thank you very much.
Thank you, Vincent. That was really helpful. So from our 4 speakers so far this morning, I've picked up a number of common themes. So the importance of building and sustaining relationships with stakeholders. So budgeting and having sufficient resources available to carry out these activities is also something which has come up repeatedly. The importance of evaluation, and also something which Vincent raised, learning together and how researchers in the community can help each other learn different things. So it's nice to hear from across the different settings in which our panelists are working, there are some common themes. So obviously we restricted our panelists and how long they had to talk, so perhaps they weren't able to include as many kind of specific examples as they might have done if we'd had longer. So I was wondering if I can ask our panelists for any specific examples of the impact of community engagement on a trial. So I wonder if I can start with you, Lungi. How have you seen the youth trial boards impact some of the trials you've worked on?
Thank you so much, Annabelle. The Youth Trial Board has had a humongous impact on some of the trials we've worked in. I mean, just looking at the past, we used to use PPIs, which are, patient information sheets, which are 15, 20, 30 pages for 7-year-olds, 8-year-olds, even 16-year-olds who wouldn't understand what is in the pack. And we say we're doing informed consent. So what the Youth Trials Board has done in the past recently is they've simplified these patient information sheets, made them youth-friendly, fun, and they've basically taken out all the information that's important for the young person to know and understand what they're participating in, and put it in a short leaflet format, which is fun and engaging for young people to read, and also has infographics. So it entertains them whilst they're reading it, and it's very informative, and it's simpler for them to understand. And we've also found that even adults find that patient information sheet engaging more than the normal PIS. So the impact of YTB is really, really evident.
Thanks, Lungi. Noni, from your experience, could you share a specific example of where the community engagement has had an impact on the study?
Yeah, thank you. I think I'll use a very recent example of COVID-19 vaccine trial. We, as a research institute, carry out a number of vaccine trials or other types of clinical trials. And so during the pandemic, we set out to carry out or to implement a COVID-19 vaccine trial. Obviously, it was at a height of, where global South and global North things were happening, and in low and middle income countries, there was a lot of mistrust on vaccines, and people think the vaccines have taken too short a time, and we don't know enough about those vaccines. And so what we did as part of our community engagement strategy for that trial specifically, we developed an animation video together with colleagues here, colleagues who have since left the program, Dr. Alan Davis. So he actually put it together, but we developed the storyboard and reviewed the different concepts that we wanted. It was a video that was specifically showing how that, specifically the AstraZeneca vaccine, how it was developed, how the vaccine has been done. And that video was picked up by our media houses. So some of our large television station used that exact video to explain to the broader public, how the vaccine was done. So that helped to ensure that the trial went on, from start to end without any major issues. Recruitment was a little bit slow, but eventually we were able to recruit all the participants that were needed, and it gave us an opportunity to go on radio and have conversations with the broader public about clinical trials and what clinical trials are. Because so that people have that understanding of what a clinical, what we mean when we say we are conducting a clinical trial. Thanks.
Thanks, Noni. Vincent, you talked in your talk you mentioned the PrepVac study. I wonder if you can give us an example of how community engagement had an impact on the PrepVac study.
Thanks, Annabelle. The PrepVac trial was one of those complicated designs. We had 2 active vaccine arms. We also had a placebo arm, but within the same trial, we also had randomization to 2 regimens of PrEP. That's Truvada and Descovy. And so you can imagine talking to people about this type of trial design where you want to test if vaccines work, yet you also want people to use PrEP. So we also had this concept of vaccine-induced seropositivity. If vaccines teach the body to make antibodies, then if people test using ordinary testing mechanisms, it will show that they are HIV positive when actually they are not. So this vaccine-induced seropositivity was a big challenge to us. So we said, how can we explain this to the community? So what we did was we took it to the community advisory board, the peer leaders, the health workers, the media, and then we said, this is a concept that we want to put in the simplest terms possible. So they said, fine, for the trial, you develop a booklet that summarizes the trial so that the design becomes less complicated to the ordinary person. So we developed a leaflet that summarized the 13, 17 pages of the informed consent document in a very smart way. Any person who reads that booklet will understand what the trial is all about. But then for the vaccine-induced seropositivity, we were advised to visualize it. So we developed an animated video where we demonstrated how, if a vaccine worked, how it would teach the body to make antibodies, and then how those antibodies would help the body to develop a defense mechanism against HIV infection. But we were also very conscious that we were testing these vaccines. So the animated video actually said that the body might develop antibodies, but it is not a guarantee that those antibodies will work against HIV. And I think that was very, very helpful, because once it is about 10 minutes and it contains everything about vaccine positivity, induced seropositivity. So once we started sharing this video with the different stakeholders, including the participants, their understanding of that concept was so much enhanced that we did not have any questions coming our way. And everyone could explain this to his fellow participants, even to his community, that the vaccine might teach your body to make antibodies, but this does not mean that you have developed, the vaccine causes HIV infection. And even when we were sharing results in the recent past, people could still remember that we learned a lot more from the leaflet that you developed and then the video compared to taking us through the detailed informed consent document, much as they got the information, but this creativity that we developed with the communities actually made the trial comprehension a lot better than we had anticipated.
Thank you, Vincent. Kate, you gave some specific examples in your talk, so I've got a slightly different question for you. I was wondering if you could give us an example of when you've learned something surprising through community engagement.
I think for me, what I've found surprising is that when researchers are really new to doing PPI, it's a real cultural shift for them to be able to give up that power and control. And it's an interesting process to watch. But when they have done and they've allowed the PPI contributors to input in a meaningful way as they should, they can really see the value of it. And really see the impact that it can have on their study and trial. And I think going forwards, that's obviously really useful that they sort of embrace the PPI, but at the beginning it can be quite tricky for them.
Thanks, Kate. And that kind of links to something Vincent said in his talk about the importance of engaging basic scientists and other scientists with community engagement. And I know you also mentioned you'd done PPI in methodology research. How do you help these researchers who are maybe not familiar with community engagement or PPI to understand the value it can give to research? That's a question for Kate, and I'll also come to Vincent and any other panelists who want to comment on that. But let's start with you, Kate.
I think it's really important to support the researchers through that process as well. So having someone like myself as a bit of a mediator to almost like teach researchers how they should be communicating and liaising with their PPI contributors and how they should be working together is really important, but also to explain to the PPI contributors where the researchers are coming from, and that, for example, methodology is such a different area. It's everyone's learning, and it is a harder subject for our PPI contributors to understand at the beginning as well. So I think it's just a learning process for everyone, but if you can have someone to support that, it really helps. And I think we've learnt from the methodology PPI pilot on how to improve that going forwards as well.
Thank you. Vincent, any thoughts from your experience?
Thank you so much. So what we've done, we've purposefully engaged the lead scientists to make sure that they fully understand the value addition of community engagement and involvement to the research processes. We have sometimes organized trainings for them to appreciate the value addition of community engagement. We've also asked them very intriguing questions. For example, if you suggest that you need to bring the media on board, and then someone says, how does that translate into recruitment and retention? then you ask them, supposing you've recruited 500 participants, and one day a media house in Uganda runs a negative publication against your trial, and you lose them to Fallout. How does that, what does that mean to you? And they all seem to be in agreement that that would be devastating. So over time, our senior scientists, be it laboratory scientists, immunologists have come to appreciate the value addition of community engagement, and because we also need to understand what they do so that we can explain it to the communities. They also need to understand what we do so that they can explain to their fellow core scientists. And I think that mutual relationship between our teams and the teams of the core scientists has been gaining ground, and we are very proud of this type of development.
Thank you, Vincent. Thank you, Kate. So the organisations our panellists work for are fortunate to have specialists working who can help do that support, work with researchers to engage with communities. But obviously not every organisation has that advantage. So I wonder what advice the panellists would give to organisations who don't have specialist staff for this. Noni, would you kick us off?
Yeah, thanks. Interesting questions. It is true indeed that it's not everyone who may have similar resources to have a large team, perhaps that has different kinds of engagement specialization. I think the most important thing is to be able to recognize your own skill set. So where you lack, then you look around you in terms of trying to find support within, for example, the locality where you're going to be working. So for example, when we were setting up our community engagement platform, the people who are brought on board were generally people who are familiar with community, sort of like community related activities, community entry, community health, community development. So where you do not have a strength, or you don't have a team, then it is important to be able to partner. Identify partners in the community, partners in the region where you are working. There could be institutions that you could bring on board and sub-grant, assign some budget line to enable them to support you. Obviously, they will need training. Because you're perhaps bringing on board a group or a community person who may not have a good understanding of research concepts, and so you will need to train them to bring them up to speed, understand research ethics, research concepts, for them to be able to support you in your community engagement. So that is generally the one of the best ways in terms of being able to partner with others. Work with local community members, bring on board local community members, maybe on short-term contracts, to be able to support you in doing the community engagement. Also looking at partnering maybe with the media, partnering with journalists, who then can also help you access, send out your message to others, but also being careful so that it is not one-sided conversation when you're working with journalists, but you're using opportunities where, for example, we have live radio programs where community members and the public can call in and share their thoughts, share their views, and then have a scientist or a radio presenter respond to their questions or pass on those questions to the scientific team, and then the responses are handed over that way. So I think that's how I'll respond to that.
Thank you. Do any of the other panelists want to add to that? Okay, we've had a couple of questions in the Q&A around how do you work with communities, maybe with religious beliefs or cultural traditions, which maybe go against some of the things, or there's conceptions that it goes against some of the things you're trying to do through your research. I wonder, Lungi, Noni, Vincent, whether you could have a go at addressing that. Vincent, any thoughts?
Yeah, thanks so much. We know that we can't all believe the same way. I think that's the starting point. We know that people think about things differently. I am a Catholic and I work for a research institution, and I've been in this type of work for some good time. I maintain my relationship with the Catholic Church, even when I know that sometimes they will not support some of the preventive options that are currently available for HIV prevention. So, but the most important, the most effective tool is to make sure that we bring them on board. For example, the chairperson of our community advisory board is a Catholic priest. And since he joined, we've gotten audience of the Catholic Church like never before. And we've interacted with them, and we've struck common grounds on which we can work together. And so building that sort of relationship helps you to convert even people that might seem to be opposed to what you are doing. They might be opposed to it not because they know what you are doing, just because they don't have any information about the value addition of what you are doing. So I think the best practice is to make sure that don't take somebody's views by their face value. Try to understand them. Try to understand why they are opposed to some of the aspects of what you do, and then explain. Once you explain, you can agree and then say, okay, I will not come to church to talk about this. When I come to church, I'll talk about ABCD and leave out what you don't want to hear. But when I meet people outside, I will tell them everything. And that's, you reach a mutual agreement on how you can work together, because we also know, and we know that people with faith-based opinions are also interested in ending this epidemic. For example, when we talk about HIV and other diseases. So it's just because we have different perceptions. So you must accept them and ask them to accept you so that we can form partnerships and work together. What they can't say, you say it. What you can't say, they say it. And that synergy helps to build a team that includes all divergent views.
Thank you, Vincent. Noni, anything to add to that from your experience?
Culture, traditions, religions that are different, always a challenge. So I'll respond using an actual example, which I think I shared. So there could be people here who have joined who may have had this already. So apologies for repeating it. So we've been carrying out HIV studies within our research center, and a lot of the HIV studies have involved sex workers, and even more specifically, men who have sex with men, so MSM, and then gradually expanded the group to include, transgender and so on and so forth. And so at one point, we really had a clash with our religious leaders and even just the community as a whole, because that goes against, the local culture and even religion here where we are. So we really had to, first of all, listen. So when it comes to culture, traditions, religion, you listen, you take in and appreciate the concerns, take in and appreciate, what the feedback you're getting from community members. So that is what we did. We held meetings with our religious leaders. We held meetings with community members to hear them. Hear and acknowledge their concerns. And then that also gave us an opportunity to provide factual information about what it is exactly that we were doing. So there were rumors around promotion of homosexuality, that we are using our HIV clinic to promote homosexuality. So meeting with these religious leaders, meeting with community members enabled us, provided us a platform to be able to actually share what was happening in that HIV clinic. The other thing that we did aside from meetings is we invited, we opened up the HIV clinic. Initially, it was closed, mostly just being used by, the sex workers and male sex workers who sell sex to other men. So what we also did is we opened up that HIV center, and we also made it like an STI clinic. And so the general public was able to just walk in. If somebody had an STI, they were able to walk in, get their STI treated, be given medication and treatment free of charge. So really, when it comes to culture, sometimes you really can't go against culture, but it's very important to demonstrate that you're listening and you hear, and you're able to then respond to aspects of your work that need responding to, and clarify any issues that may not be clear to the community members. There was one other study that was done before I joined, but I came to hear about it, and this was a study. So two studies actually. One study where we needed to assess breast milk. Culturally, in the Kenyan context, I don't know about other African setting, but in the Kenyan context, when you express breast milk, that breast milk needs to be used up. You can't like just discard it and throw it away. So that was one study where we needed to consult the community members in terms of how best can we carry out that study, where we need to get breast milk, and how can we then either sensitively maybe dispose of the milk, or what happens to the milk once it has been collected. The other one was a cord blood study, where we are taking cord blood, that is a umbilical cord once a baby has been born. So taking sections of the umbilical cord. In our culture, the umbilical cord is normally buried either at the back of the house where the baby has been born, where the baby has come from, and so on and so forth. So we needed to be sensitive in terms of how are we handling the umbilical cord. So the things that we did was making sure that we are engaging the population, having meetings with them, discussing what the study procedures will be like, and then allowing the community members to give their suggestions and recommendations of how best they thought some of these sensitive areas could be handled. Thank you, Annabelle.
Thank you, Noni. So we're at the end of our designated time, but hopefully the panel members will be able to stay online for another 10 minutes so we can get through a few more of the questions, because I think the discussions are really interesting, and it's great to hear from the experiences of the panelists. So those of you who are attending, I hope you can stay with us, but if not, the full recording will be posted on the Global Health Network MRC CTU hub, so you can catch up on that after the event, and we'll continue our discussion here for a few more minutes. So related to that question, so we talked about where communities maybe have different views from the researchers. There's a question from Alistair Campbell from South Africa. How do we protect study participants when the research is focused on activity which is illegal in the country in which it's conducted? So that might be, for example, sexual orientation in countries which have laws about that, or it might include illicit drug use or provision of harm reduction services. So I know this is quite a big issue in HIV research. I wonder, Vincent, any thoughts on this in the Uganda context?
Thank you so much. That's a very, very interesting question. We know that commercial sex is illegal in Uganda, but we also know that declaring it illegal does not stop people from engaging in it. And we know that once you leave some of the high-risk populations unattended to, then you cannot control this epidemic. So the method we've used is to make sure that we make the authorities that be understand why such communities need to be involved in research. One, they are the ones that will need some of these interventions. For example, if we ever come up with a safe and effective HIV vaccine, the people that will need it most are those that are at most risk of HIV infection. So the other thing is also to make sure that we involve a wide range of stakeholders, community leaders, cultural leaders, not condemn, because condemning what people do does not take it away. What we need to do is to make sure that people do understand that these people need services that can protect them from getting infected with any disease that might eventually affect the wider community. So once you bring it in that way, that much as it is illegal, much as commercial sex work is illegal in Uganda, these people need services. And you go to the Ministry of Health, you engage with the regulators, you engage with the National Council for Science and Technology, you also engage with the local powers, the police, and once a year we have what we call a high-profile stakeholder engagement, where we engage the army, the religious leaders, the topmost leadership of all those institutions, to make them aware that we need to work with these communities and make sure that no one is left behind, as we try as much possible to make sure that we do research that will benefit the entire community, not just a selected few members of the community. We do not want to address the moral question. We want to address the scientific question, and that's our answer. So our answer is that we're not addressing the moral question. That's, for example, for you as faith-based leaders to do. For us, we want to address the scientific question, and for us to succeed, we must work together. As partners, we must combine our efforts, we must combine our skill sets, and knowledge. And once you do that, you see that you provide what we would call what I always call a supportive social environment for people to participate in clinical trials, even when they are involved in such activities. So what is important is not to look at the participant as an individual, but to look at the wider community in which that participant lives, and try as much as possible that you make them aware why you are doing this type of research and why you would need this category of people to participate in this type of clinical research. Once you do that, then you definitely not win everyone on your side, but once you have most people appreciate what you do and provide support for people to participate in clinical trials or any other research, then you are good to go. But the most important thing is also to make sure that people who participate in clinical trials are protected as much as possible. We ensure the highest level of confidentiality. So we do not disclose someone's participation in any clinical trial. But if they are free to disclose to their colleagues, it's up to their choice. And we also have a network. We have a system that helps them mitigate social harm in case they encounter it.
Thank you. So that's a really interesting discussion around challenges in some particular research topics, which maybe go against particular cultural traditions or legal things. But I want to move on now to a different question, which is, you all spoke about the importance of evaluating community engagement. I wonder if you could give us just some top tips or hints on how we might do that, or share some resources that people might find helpful. And I'm going to start with Lungi, and then I'm going to go to Kate, because I know she's been thinking about this as well. Lungi, how do you evaluate the impact of the things that Youth Trial Board develop?
That's actually thank you so much, Annabelle. That's actually one of the challenges that we have. And we are currently working with Kate to overcome these challenges, because we want to have a proper evaluation of the work that we've done. So some of the evaluation that we've done in the past doesn't reflect entirely on the impact of the material that has been produced. So we have some evaluation, but it's not very impactful. It doesn't really show the full impact. So with what we've done, we are working with Kate to kind of see if we can use the data that we have to properly evaluate the work so that we can give you good answers. When you're asking us stuff like this, we need to be able to say this is the impact that it has done. And that being noted as a challenge, even the trial teams are working with us to try and assist us to put systems in place so that the evaluation of the work is done from the beginning, so that by the time the material is produced and is rolled out, we can evaluate the pre and post use of that material. But Kate, I know you got some material that you're currently using.
Yeah, so we're starting to use the people, the NIHR impact logs. So that's from the People in Health West of England, because those tools are very simple and they're short as well. Because one of the main reasons when we speak to our trial teams and studies about why aren't they evaluating the impact of their PPI, it's just that they don't have time and they don't know how to do it, and they don't have funding to give to their PPI contributors to input into that. So we want something really simple and straightforward. And these logs are just 2 surveys. You give one to the researchers and one to the PPI contributors about how they found that experience. You can also do it after every PPI activity, or you could just do it at the end of a project. So we're still learning, and we're just going to start using them. So perhaps we'll have another webinar in the future and I can feed back on how that's gone. There are obviously other tools out there, but a lot of them are quite time consuming or in different formats like spreadsheets. So it's really trying to think about the audience that you want to complete them as well, and what will be most suitable for them. So if you've got young people, maybe having a survey they can just access on their mobile phone is the best way. But yeah, it's we're learning. It's a process.
Thanks, Kate. Maybe if there's any links to some of those relevant resources, you could perhaps put them in the chat. Noni, you spoke in your talk about different motivations, I guess, for community engagement, one being intrinsic value of it and one being instrumental. Do you think there are different approaches to monitoring and evaluating those 2 different aims of community engagement?
Thank you. So, I mean, when you think about relationships and we want to evaluate relationships, then you're relying on people being able to report what they think has changed, how they think they have been valued, whether trust has happened or trust has not happened. We have used mechanisms such as films. For example, we developed a film with our CAB members where we were examining trust and what they think about trust, how they see trust being built and being broken, and what kind of mechanisms can be put in place to remedy where trust has been broken. Unfortunately, that video is not publicly available, but when we developed or when we were creating that short film, it really helped us understand the aspect of relationships, which is the intrinsic value. When it comes to the instrumental, there are different ways. We speak, for example, with researchers. We send out surveys to scientists to examine how they are experiencing engagement and what they are learning from the engagement from the population, but also what they are learning themselves as a skill in terms of communication and engagement. When it comes to community members and their participation in engagement, we have also held things like focus discussions with community members to be able to understand, and of course, using FGD moderation tools, discussion guides, and asking them questions about different aspects of engagement and what they think about it, including whether they think certain engagement approaches are still relevant or they need to be changed, or whether there's a certain engagement approach that we are not using that they feel would be quite effective. For example, our radio program was as a result of engaging and evaluating and community members telling us, if you also were on radio, you would be able to reach a couple of people. We have done a monitoring and evaluation report. We have a protocol, an ethically approved protocol that guides our monitoring and evaluation work. We've developed a theory of change, and the theory of change and the protocol are not yet publicly available. We were in the process of developing a manuscript and publishing our protocol so that people can get to see how we do our evaluation. But we have a report, a community and public engagement evaluation report, and I'll post the link to that on either on the chat so that it can be shared with others.
Thank you. That's really helpful. We've run out of time now, unfortunately, which is a real shame because there's so much more to discuss, so many more questions in the Q&A to get to. So we will review those questions after the session and ask our panel to respond to those in writing if they're able to. As I said earlier, the recording of this session along with additional materials will be shared, and the link to where you'll be able to find these will be posted in the chat now. There's also a QR code on your screen where you can link to the MRC CTU hub on Capacity Strengthening Hub on the Global Health Network, which is where all these resources will live. And just to highlight that coming out in the next week or two, Kate has kindly curated a list, an essential reading list on patient and public involvement, which will have lots of resources which may help answer some of these more practical questions that are coming up in the Q&A. That's a reading list, so it picks out some essential resources, and there's also a quiz you can complete at the end of it to get a certificate for engaging with that material. So do look out for that. That should be live in the next week or two. Thank you very much to the panelists and to everyone attending for what's been a really helpful and interesting discussion. So much more we could talk about here. Maybe we need to do something in the future, exploring more depth in community engagement. So thank you to everyone who's been involved. I hope you found it interesting and useful. Please do send us your feedback on the session and whether this was useful and potential topics you might like us to address in future webinars. Thank you very much, everyone.
Bye.
Thank you for having us, and thanks so much for your facilitation.
Bye, everyone.
Thank you, everyone. Bye.
And thank you to the Global Health Network team who facilitated this call as well.